Good afternoon. I'm Dr. Sue Pressman, ACA's 69th president. Welcome to the 2021 Virtual Hill Day Briefing. Today, we celebrate ACA's advocacy efforts on behalf of the counseling profession, as well as the role that licensed professional counselors play in guiding federal legislation. Advocacy is an essential component for advancing our profession. It allows lawmakers to hear firsthand many of the challenges that face professional counselors and their clients. Our ACA Government Affairs and Public Policy team advocate on our behalf every day, but those in Congress want to hear from you, from all of us, their constituents. Now is our opportunity to have our voices heard and to amplify the voices of many in the counseling community. Today, we will hear from legislative staff and policy experts on the importance of the Medicare Access Improvement Act, which would not only allow professional counselors to bill or invoice Medicare, but it would also provide greater access to mental health services to millions of Americans. We will also receive tips on how to set up and conduct a successful congressional meeting, as well as be provided resources which will provide us with the tools needed to execute advocacy efforts and act on the local, state, and federal levels. Please take this opportunity to fully engage in today's presentation. It is ACA's goal for you to take away critical information that will serve you and your clients for many years to come. Thank you and enjoy today's briefing.
Hello, I'm Richard Yep. I'm the CEO of the American Counseling Association. But before I had this job, I led ACA's government affairs effort. Before that, I worked on Capitol Hill. I know firsthand the importance of having members of a profession advocate for critical issues, not just for themselves, but for those whom they serve. We all know that licensed professional counselors have the education, training, skills, and expertise to make them key mental health providers in the challenges faced by so many individuals, couples, and families. Professional counselors need to be able to provide a seamless continuity of care for clients who may be transitioning into services funded through Medicare. I'm confident that elected officials and their staffs will support the inclusion.
Good afternoon. I'm Dr.
That licensed professional counselors have the education, training, skills, and expertise to make them key mental health providers in the challenges faced by so many individuals, couples, and families. Professional counselors need to be able to provide a seamless continuity of care for clients who may be transitioning into services funded through Medicare. I'm confident that elected officials and their staffs will support the inclusion of LPCs as independent practitioners under Medicare when they learn about the work that you do. When you educate elected officials on this issue, you're advocating for the counseling profession and for your clients. But I also want you to know that in addition to Medicare, the ACA Governing Council has approved an ambitious public policy agenda for the association, one that encompasses issues that include but are not limited to school counseling, career development, telebehavioral health, racial justice, and civil rights. Your role in communicating with public policy officials has never been more critical. I know that you have so much to do as a practitioner, a counselor educator, a supervisor, or a researcher. Today, we are asking you to also take on the role of public policy advocate for the profession and for your clients. The staff and leadership are honored that you are giving your time to this ACA Virtual Hill Day. I hope you'll find it to be productive and fulfilling. Best of luck in your role as an advocate for the counseling profession.
Hello, everyone. My name is Brian Banks, and I'm the Director of Government Affairs and Public Policy for the American Counseling Association. I first would like to thank our President, Dr. Sue Pressman, and our CEO, Richard Yep, for that great welcome. Before we jump into the program, it's very important for me to let you know that the Q&A, the question and answer for your questions, is open on this Zoom event. If you have a question, we will do our best to answer it during the event. If not, someone from the Government Affairs team will follow up with you. Welcome again to the 2021 Virtual Hill Day. So let's talk a little bit about what we do as a team. It's very important for me to let you know that the team of 4 at ACA, it's a mighty team where we focus on federal affairs, state affairs, grassroots engagement, and we also work with regulatory agencies such as your licensure board. It's not just the government affairs team that's doing this work. We have great partners. We have a partner in Dr. Matt Fullen, who operates as our Medicare consultant. We have partners in our PPLC, our Public Policy and Legislative Committee. And we also have a third-party lobbying firm, Arnold & Porter, that helps us with our strategy as we work on Capitol Hill. Now, again, a mighty team of 4. So what is it that we're doing when it comes to the federal government and our agenda? As Richard Yep mentioned, our agenda is approved by the Governing Council, but how do we get to that point? We work closely with the PPLC committee, as well as our general membership, to shape our agenda, and that agenda is reviewed by the Governing Council and approved, which gives us our charge to work. When you look at our agenda, you see everything from Medicare reimbursement to COVID-19, telehealth issues. On the state side, we're working with the Interstate Compact Program, ethical and educational standards, and more. There's so much that we do today, and we're excited to be the arm that supports our membership in their advocacy efforts. Now, as we noted, there are a lot of issues we work on. Today, we're going to have a huge focus on Medicare reimbursement. The Mental Health Access Improvement Act of 2021 is HR 432, House Resolution Bill 432, and Senate Bill 828. Today, we'll give you an overview of the bill, talk about key points. Later in our session, we'll have a short break, and we'll come back and we'll actually meet with legislative staff who will talk to you about good tips that you can use when you're meeting with a staffer or someone on Capitol Hill, whether it's in your district or on Capitol Hill or virtually. So let's get into it.
Everybody, I'm Christine Blackwood with Arnold & Porter, and I'm accompanied by Dr. Matthew Fullen, and we've divided up the next part of the presentations. So Dr. Fullen is going to be kicking things off.
Gila, I'll hand things over to you, and then I'll be ready to pick things up.
Sure. Thanks, Dr. Fullen. My name is Gila Todd. I'm the Public Policy and Legislation Manager for the American Counseling Association. I'm joined by Christine Blackwood and Dr. Matt Fullen. And just to give you guys a brief introduction, Christine Blackwood is counsel in the Legislative Practice and Public Policy Group for Arnold & Porter, an international law firm based in Washington, D.C. She represents a wide range of healthcare sector clients on healthcare policy issues on Capitol Hill and with the executive branch, including medical societies and health professional associations, such as the American Counseling Association. Christine came to Arnold & Porter after serving in the office of the Secretary of the Department of Health and Human Services under the Obama administration, where she helped manage HHS's response to congressional investigations involving the Affordable Care Act, excuse me, and other programs and initiatives, including mental health and substance abuse programs. Prior to serving at HHS, Christine was chief counsel for the Senate Special Committee on Aging, chaired by Senator Herb Kohl of Wisconsin, where she worked on provisions of the Affordable Care Act, and as investigative counsel for the House Committee on Energy and Commerce, chaired by former Representative John Dingell of Michigan. where she focused on healthcare policy and investigations. Ms. Blackwood also spent over 12 years as a career attorney in the Department of Justice, serving first as an assistant U.S. attorney working on healthcare fraud and abuse, and then as the National Healthcare Fraud Coordinator. She received her Bachelor's of Arts degree from Boston University and her JD from UCLA School of Law. We're also joined by Dr. Matt Fullen. He's an assistant professor at Virginia Tech and the counseling profession's most active scholar on mental health counseling for older Americans and Medicare mental health provider policy. He's the lead author on 23 publications focused on aging and mental health. He's a recipient of 2 Innovative Research on Aging Awards from the Mathers Institute, and was recently awarded the 2020 Carl D. Perkins Government Relations Award by the American Counseling Association due to his work on Medicare mental health advocacy. Dr. Fullen currently serves as Medicare mental health research consultant to the American Counseling Association. He has been instrumental in advancing evidence-based advocacy on behalf of older adults through his scholarship, outreach to lawmakers, and leadership with the American Counseling Association. Dr. Fullen's research on Medicare mental health access has been cited by the New York Times, and he regularly consults with mental health organizations on developing materials utilized to communicate about the issue of mental health access for older Americans to lawmakers. Please welcome Christine Blackwood and Dr. Matt Fullen. Dr. Fullen.
Thanks, Gila. Thanks, Christine. It's good to be with all of you today. We're excited to talk about many important issues, but the one that is near and dear to my heart and plan to spend some time talking about is the importance of Medicare reimbursement for counselors. This first really became an issue that I was aware of about 10 years ago, and that was working as a licensed professional counselor in Ohio, having started a practice where I was working within long-term care settings and had many older adult clients who I was able to work with via Ohio's Medicaid program. As I began to work with one client in particular, I'll call her Geraldine. This was a woman in her 80s who was experiencing depression and anxiety, who was really benefiting from some of the work that we were able to do together. But I'll never forget the day that I got a phone call from my boss explaining to me that without any additional notice, I needed to stop working with Geraldine. And the explanation for that was simple and yet very profound. My boss explained that Geraldine was now primarily covered through Medicare due to her transition into the hospice program. And because hospice is a Medicare benefit, the state of Ohio at that time, kicked any of her claims to Medicare as opposed to Medicaid. And on a dime, I was no longer able to work with this client and told so very simply by my employer. And from that point forward, it really became clear to me that the way that current Medicare policy is set up disadvantages many older Americans and other people who are covered by the Medicare program. So we're going to talk about this, try to set a little bit of the historical landscape for how we got to this place, and talk to you a bit about some research that we've done on Medicare reimbursement, on access to counseling services, and try to equip you with some key talking points to be able to take with you as you interact with legislators. So first and foremost, it's important to think about the Medicare program and what adding mental health counselors to this program would do. So we know that there are over 60 million Americans who are covered by Medicare. About 85% of that number are people ages 65 and older, and then the remaining 15% are younger than 65, but covered by Medicare due to having a long-term disability. Adding mental health counselors would provide support for all of these individuals and would allow them access to licensed mental health counselors as well as marriage and family therapists. And I want to say that counselors are great advocates, especially when their clients are hurting. And it's important to note that client advocacy is Medicare advocacy, and Medicare advocacy is in fact client advocacy. A little bit of history. The Older Americans Act states that older people have inherent dignity and are entitled to equal opportunity to, quote, the best possible physical and mental health which science can make available and without regard to economic status. So in 2020, Congress reauthorized the Older Americans Act, And when it did so, it really doubled down on this commitment that we have as Americans to ensure that older adults, as well as other people covered by Medicare, have the same quality access to mental health care as people of other ages. And so what I would like to argue during our time together this afternoon is that there is a discrepancy currently between the aspirational values of the Older Americans Act and the Medicare program, which aims to meet these needs equitably, regardless of a person's age or socioeconomic status. There's a disparity between that aim and the realities, the fundamental realities that we run into. So let me just share with you a couple of the statistics that are here on the screen. We know that people as they age do experience mental health concerns, just like people of all ages do. And approximately 1 in 5 people ages 55 and older has a documented, mental health concern. Additionally, we know that there are disparities that have to do with geography, where individuals living in rural communities may have a harder time accessing quality mental health services. Oftentimes, this is because the providers in their geographical community are not allowed to be covered. And we'll talk a little bit about how that interacts with this Medicare mental health issue. But we know that rural communities, due to the combination of either not having providers or the providers there not having the right sort of credentials to unlock services, these are things that make rural communities have an outsized issue when it comes to mental health care. And we also know that, in light of COVID-19, an added emphasis on Americans' mental health and perhaps an increased awareness across the country of the thing that we have known all along, that mental health is health, that mental health care is health care, and that individuals deserve to have the same access to these mental health services as they do to other forms of health care. And yet we may know that, we may be increasingly aware of that as a country, but are still trying to determine ways to make that a reality by giving people equal access. So when we talk about the 60 million Americans who are presently covered by Medicare, we can also say that these individuals currently do not have the same equitable access to mental health services. And we're going to spend some time talking about why that is. One note that I'll make before we move on to the next slide is that Medicare mental health regulations were last updated in 1989. So 31 years ago is the last time that Congress formally increased the types of providers, mental health providers specifically, that were eligible to be reimbursed under the Medicare program. So in 1989, there were restrictions on psychologists that were removed, and clinical social workers were added as qualified, eligible Medicare mental health professionals. In the ensuing 31 years since that point, we know that the mental health marketplace has evolved rapidly. And frankly, licensed professional counselors, as well as licensed marriage and family therapists, now comprise a much higher proportion of the nation's mental health workforce as compared to the reality in 1989. And since 1989, not only has the marketplace evolved, but we know that there has been a rapid increase in the number of individuals covered by the Medicare program. In fact, we might say that it's nearly double the number of Americans who are covered by Medicare today compared to in 1989. 10,000 people turn 65 today. 10,000 new people will turn 65 tomorrow. And every day this week, the same story, 10,000 additional people turning 65 and therefore eligible for the Medicare program. And so what that means, as you connect these dots, is that we will have more and more people relying on Medicare for their healthcare access. And meanwhile, we will have a lower and lower proportion of the American mental health workforce that is available to these individuals. And that is really where we are at on this issue. We've known this is coming for some time now. ACA and other entities have been working on this issue for some time. But this is really coming to a head when you think about the rapid increase in the number of Medicare beneficiaries, which again is up to about 62 million people, as well as the fact that nearly 40% of the behavioral health workforce is not currently covered by the Medicare program. And then when you throw in COVID-19 and many of the consequences and ramifications that we know to have been happening since the pandemic, we really have, we really find ourselves in this precarious situation where if we don't act soon, we're going to have an even greater crisis on our hands. If you would move on to the next slide, we'll talk a little bit more about this, these contextual pieces. And hopefully these are things that translate into important talking points as you're sharing your experiences and your concerns with legislators. So I mentioned that this is the primary insurance provider for 62 million Americans. And when we say that these 62 million people are covered by Medicare, part of what that means is that if they want mental health services, they really have no choice but to use Medicare eligible providers. So that means that if I have a Medicare card, if I use Medicare for my healthcare access, and I would like to have access to a mental health provider for depression, for anxiety, for any host of other issues that may prompt me to seek services, I will most likely turn to the community agencies or the private practices in my community, and I will reach out to those agencies and try to find a provider. Immediately, what I will likely experience is that these agencies and these practices will let me know that because I use Medicare, I don't have access to, again, roughly 40%, in some cases higher than that, but that high proportion of providers in that agency or in that practice. So that means that I'm restricted in terms of what I can do, who I can meet with, what options I have, and how quickly I can meet with a provider. What's unfortunate about this situation is that Medicare is really the sole provider that is in this situation. Medicaid largely covers professional counselors. TRICARE, the VA, private insurance cover professional counselors. And the problem here is that even though Medicare as a program covers counseling, it restricts the providers who are able to give that counseling service. So even though a person with their Medicare benefit may go to their community agency and say, I need help, I'd like to find help from your office, that office may very well say, we don't have the kinds of providers available on our staff who can work with your insurance. And so that means I either will have to refer you, I may have to put you on a wait list that is much longer than the wait list you would otherwise receive. I may have to ask you to wait up to 30 days, maybe longer than that, to see one of our Medicare eligible providers, even though I might have a licensed counselor who could work with you tomorrow, simply because of the lack of modernization of the Medicare program. We also know, as I mentioned, that COVID-19 has really exacerbated these issues. We've seen recent data suggesting that older Americans are increasingly likely to experience social isolation, loneliness, and bereavement related to the pandemic. And the rates of anxiety and depression have increased. Currently, when we last did this, when the Kaiser Family Foundation last did this survey, it was roughly 1 in 4 older Americans experiencing anxiety or depression, which was compared to about 1 in 10 that had experienced that prior to the pandemic. And as I mentioned before, Congress has not updated the Medicare mental health provider regulations since 1989. And that's an important piece to emphasize with legislators who may not have any awareness that we are 32 years now into updating that. And that really is unsustainable and problematic for the 62 million people who rely on Medicare for their healthcare coverage, including mental health. Now, on the next slide, we have a graphic display of where different types of mental health providers are located. You can see here that the primary color yellow indicates that counselors and marriage and family therapists comprise over 50% of the mental health workforce in that particular county that's represented. So in large swaths of the country, including in many rural communities, counselors and MFTs make up more than half of the available workforce. And so when we talk about the impact of the Medicare mental health coverage gap, it really does boil down to, if I live in one of these counties that is shaded yellow, I have much lower odds of being able to find a Medicare eligible provider who can work with me. And meanwhile, so many providers in my community who would otherwise love to work with me simply are not allowed to do so because of these outdated requirements. The green counties are those areas, largely more urban areas where there may be many mental health professionals. We do know that the Medicare mental health coverage gap can impact people living in urban settings, but it may not be quite as acute as it is in some of the rural areas that we see on this map. The blue counties represent areas where we have a mental health professional shortage area. There's really not mental health professionals available. And then the red counties are those where there's only counselors or MFTs available. And so likewise, if I live in one of these red areas, I'm going to have a really hard time finding someone to work with, if I'm relying on Medicare for my coverage. We can put this into some numbers as well. So when you start, this was a study that came out in 2016, but when you start to look at the proportions between counselors and currently Medicare eligible professions, which include psychiatrists, psychologists, clinical social workers, and psychiatric nurses, what we can see is that as we enter into more rural communities, the proportion of counselors making up the mental health workforce increases. And likewise, that means that if I'm relying on my Medicare coverage to seek out mental health services, I'm decreasingly able to find a provider as I get into more and more rural areas. I will say that anecdotally, we also know that just because psychologists and clinical social workers are covered by Medicare, it doesn't always mean that they are actively accepting Medicare patients. And so that creates another press on those individuals who are covered on Medicare, looking to the Medicare program to try to access the mental health services that they need. Oftentimes, even if there are eligible providers, they have a hard time finding appointments, which is just one more reason why having a greater access to the entire mental health provider pool is so important. As we move forward, I want to share with you a little bit about some research that we've done on this issue. So we've been tracking this through some research at Virginia Tech for several years now. And one of the things that we did that really gave us some good information was a survey of American Counseling Association members that we conducted. And what we found, the survey was disseminated in the summer of 2018. We had over 6,000 people, all ACA members, who responded to us. And they gave us some really important information, just baseline in terms of whether or not ACA members and counselors are experiencing the Medicare mental health coverage gap. When we isolated this at the level of practicing counselors, so not so much students who responded or counselor educators who responded, but when we look at people who are primarily practicing counselors, 70% of survey respondents said that, yes, I have been directly impacted by the Medicare policy, and that has shown up by either turning away a new or potential client, somebody who calls my office, wants to work with me, was referred by their doctor to work with me, but is not able to because of their Medicare insurance. So we found that more than half of ACA members had that experience at some point. We found that an additional roughly 39% of individuals, ACA members who responded, had referred an existing client. So this is a situation really unfortunate where I may have an existing client who I'm working with due to a different insurance. So remember the story I shared about my client who I was able to see using Medicaid. But as soon as Medicare entered the mix, what we find is that Medicare becomes the primary insurance. And regardless of what insurance they may have been using prior to that point, it creates this really untimely transition where I may have to tell my client, I know that I previously worked with you using private insurance, Medicaid, et cetera, but now that you have turned 65, or now that you are disability eligible and therefore Medicare eligible, I'm really sorry, but I can't work with you using your Medicare insurance. And so 39% of ACA respondents telling us that they had experienced this. And then another 40% who said, I've had this issue come up, and the thing I've done to deal with it is either provide pro bono services or provide some sort of fee reduction or sliding scale approach. Oftentimes, we might have the same counselor checking all of these boxes, saying, I turn people away who call me. I've also had people who age into Medicare and I've had to refer them. And then we may have others who say, I have 1 or 2 spots that I hold open for pro bono clients, and so I've had to use that from time to time. But all of these categories are very dissatisfying to the many counselors who would like to work with this Medicare population, who see themselves as having a responsibility to work with Medicare recipients and yet are unable to do so consistently because of the current policy. And if we would go to the next slide, I'll share with you a bit more about some of the qualitative data that we've developed. So in separate studies, in addition to the survey, we had the opportunity to interview counselors about their direct experiences navigating the Medicare mental health coverage gap, as well as Medicare beneficiaries themselves who were willing to talk about their struggles trying to find mental health care in spite of Medicare access being so problematic. So this is one quote from a provider that is somewhat emblematic of what we found when we interviewed professional counselors. So we'll call this person Brandon. Brandon was a lead in the mental health wing of a federally qualified health center. And so, this was a location, an agency where they were doing cutting edge integrated care. Individuals who had a doctor or a dental appointment might be referred for behavioral health services. And Brandon would be, the first person they would work with, coordinate, having access to other providers in their community. And what Brandon told us was that he meets with the local private practice providers in their community on a monthly basis. And all of those people were just booked up. They didn't have appointments available. And this was regardless of licensure. He told us there's just not enough licensed providers in town to see everybody. And then he went on to say that, because only half of those people in his community can accept Medicare, this fact that there's so little supply of services really has an outsized impact on Medicare recipients. So he told us there's a shortage of licensed mental health providers across the board, but there's an extra barrier for Medicare recipients. And this really comes down to the fact that half the mental health providers in town can't see Medicare patients. So this is one community, but what we found through these interviews and what we know to be true through other conversations we've had is that this is quite representative of many communities where half of the providers in that community are not able to work with Medicare. And so again, if I am relying on the Medicare program, if I'm paying into the Medicare program through my premiums, the only way I can access these services is through the Medicare card that I carry. It's really, really discouraging to not be able to access half of the workforce in my community. Susan, age 57, who qualifies for Medicare based on her disability and lives in a suburban location, she told us about how hard this is for her and how she had to ultimately track down a psychologist, even though originally she was working with a licensed professional counselor. She said it's extremely frustrating. It's demeaning when you're on Medicare and can't find services, tiring, exhausting. And if your mental health already has a sense of hopelessness or helplessness, you're faced with jumping through hoops or getting so many no's or no callbacks that it begins to feel more helpless. And so she said the Medicare mental health coverage gap contributes to this hopelessness and helplessness. So you can see through the strong language that Susan used that it's really hard to, we know it's hard for a client to be struggling. We know it's hard for a client to pick up the phone, find a provider, summon the courage to go and look for help. But when they make that decision to go and look for help, and they're consistently turned away due to an antiquated policy like this, to a person like Susan, it just becomes really, really challenging, really hard. We were glad to hear that Susan eventually did find a psychologist to work with, but we wish that the Susans out there wouldn't have to call so many people just to find that one provider. And I can also tell you that we spoke with other people who still were looking for a provider, who had to rely on their counselor's generosity in providing pro bono or sliding scale services. All of these ways that the system is not set up to work as effectively as it really should. And so if we move on to the next slide, a couple of things that I want to share is that, the Mental Health Access Improvement Act, it will close this gap for older adults and people with long-term disabilities. And the reason it can do that is because it immediately increases access to over 200,000 graduate level licensed providers. Again, providers who are recognized by every other insurance provider except Medicare. And it really reduces the national shortage of mental health professionals, particularly in rural areas and other areas where people may be underserved. And so it's so important to emphasize that this is why the issue matters to the counseling profession. It matters because we want to be able to serve these clients. And we know that Medicare advocacy is client advocacy. This is why we ask you to call and meet with lawmakers, to set up these virtual appointments where we can tell them about the Medicare mental health coverage gap, share stories that you've had or stories that you've heard us talk about. And you can really use key advocacy talking points to help shape these stories. And so if I had to boil things down to maybe 3 of those key talking points, I would say that it's important for lawmakers to know about the pervasive impact that this is impacting older adults, people with disabilities, veterans. Medicare recipients are incredibly diverse. And so when we shut the door to Medicare on the whole, we're also shutting the door to a diverse range of individuals who have done nothing wrong and nothing to not deserve access to mental health services. They simply have relied on the Medicare program, which again was intended, when Medicare was launched in 1965, was intended to be the sort of resource that would prevent this very thing from happening. So number 1, pervasive impact. Number 2, it's really important to frame this issue as a lack of access, that clients do not have equitable access to mental health services. And post-pandemic, this is a terrible time to be shutting the door on people's mental health needs. The Medicare mental health coverage gap would not, solving that would not add a new benefit. It simply allows the mental health benefit that Medicare recipients already have to be fully realized. And number 3, I would emphasize that, counselors are represented in every other program except Medicare, and that Medicare needs to be modernized. This modernization has been well overdue, over 32 years now since the last time Congress made a move like this. And so it really is time to make that difference. On the next slide, what I'll just add is a little bit of hope and optimism about progress. In the last year, the last congressional cycle, we saw a record number of bipartisan co-sponsors on the legislation that we're now renewing going into 2021. There were people of diverse political persuasions who wanted to help us. And we really saw this high watermark of a lot of politicians who understood, who got it, who agreed with us that this was a problem we should do something about. We also began to see references to the Medicare mental health coverage gap in the popular media. Politico ran a story that featured some information about this, as well as the New York Times. And the Bipartisan Policy Center, which is a really important and reputable policy advocacy center in DC, they included a report on rural Americans' healthcare access that did recommend adding mental health counselors to the Medicare program. So there's a lot of reason why we have good momentum, and that momentum needs to continue into 2021 and beyond. And I'm going to hand things over to Christine Blackwood of Arnold and Porter, who can spend a little bit of time talking to us about how we do this. Christine?
Thanks so much, Matt. First, I do want to echo what the prior speakers have said, which is we are very grateful for all of you participating in this training program and for your advocacy efforts with respect to the Medicare coverage gap on Capitol Hill. It is critically important that your members of Congress hear from you. They can hear from those of us in Washington, D.C. All day long, but what really matters is that they're hearing from their constituents and they're hearing your voices that are not only speaking on your own behalf and on behalf of other counselors, but also on behalf of a very vulnerable Medicare population, which, as you've heard, is not only individuals, older Americans who are over 65 and who are in need of mental health services that they cannot access readily because of a workforce shortage, which counselors and marriage and family therapists also under this bill would be able to provide. And also, quite ironically, those younger individuals, younger Americans who are under 65 but are eligible for Medicare because of their physical or mental disabilities, and who in many instances really could benefit from the services that you all provide as counselors. So just to start where we are in terms of the status of this legislation in Congress, there's a House version of the legislation, and then there's an identical Senate version of the legislation. In the House and in the Senate, we have bipartisan, wonderful sponsors who have taken the lead on this, getting this legislation over the finish line this year. Mike Thompson is a Democratic congressman from he represents the northern part of California. He represents Napa and Sonoma counties, and he is one of the senior members of the House Ways and Means Committee, which has jurisdiction not only over taxes, but also over the Medicare program. And so he's really in a great position to help with this bill. The co-sponsor on the House side is Congressman John Katko. He is a Republican from upstate New York. He's also a very well-respected leader. You may have heard recently about Congressman Katko as one of the leaders on legislation on the January 6th commission. Both these congressmen work incredibly well across the aisle with each other. And you'll be hearing in a little bit from Representative Thompson staffer, Crozier Connor, and from the staffer for our Senate lead. So if you could go to the next slide, please. So these are our two Senate champions. Senator John Barrasso, Republican of Wyoming, is the one who introduced the bill in the Senate earlier this year. He is a member of, like Congressman Thompson, he is a member of one of the key committees of jurisdiction on the Senate side of Congress. The Senate Finance Committee, which somewhat like the House Ways and Means Committee, has jurisdiction over both taxes and the Medicare program. Part of the reason for that is because, as you probably all know, Medicare, a portion of our paychecks go to the Medicare program, so that we can all eventually receive the benefits. Our co-sponsor in the Senate Senator Debbie Stabenow. She is also on the Senate Finance Committee, which is a key position. She chairs the Health Subcommittee of the Senate Finance Committee. She has been a longtime champion of mental health, greater mental health access and improvement of mental health programs. Going back to Senator Barrasso for a minute, Senator Barrasso, coming from the state of Wyoming and representing that state, brings to this issue the perspective of somebody who represents a very rural state, which is one of the issues in terms of kind of the disconnect between the supply, as Dr. Fullen was talking about, the supply of mental health professionals and the fact that there are extreme shortages of mental health professionals, at least those that are currently eligible to bill the Medicare program, and the number of Medicare beneficiaries who live there. So being in a rural state like Wyoming, Senator Barrasso has a lot of concern about the fact that that rural constituents of his are not getting the kind of mental health care that they should. We could go to the next slide. We're not quite at raffle time. I wanted to talk a little bit just about the overall framework for this bill, sort of the political context that we're in. We have just over the next few minutes. So as you probably have all read in the news and heard, Congress is extremely busy this year, and it could very well be a pivotal year in terms of legislation, and including for this particular measure. We're very hopeful. Congress is thinking big. The administration is thinking big. They're thinking about making long overdue structural reforms, and we're talking about infrastructure, and there's a debate about the scope of what we mean by infrastructure and whether we need to include what they refer to as the caring infrastructure. And there's a lot of discussion right now about the Medicare program, about expanding access to the Medicare program, potentially lowering the age of eligibility. And there needs to also be a continuing dialogue about the quality of the Medicare program, which is where this issue really fits in, because we know very I'm sorry, I was on mute. As you all know, as counselors, you know that your physical health and your clients' mental health are really part of the big picture, and that is particularly true for Medicare beneficiaries as they get as we all age. The more when we have physical comorbidities and mental illness, those can exacerbate not only the condition of the individual, but also on the Medicare program, we're talking about a taxpayer-funded program, at least in part, and also beneficiary-funded, that can become very expensive if we're talking about inpatient hospitalization for people because of multiple comorbidities and that can be exacerbated by mental health conditions, or vice versa. The mental health condition may be the predominant diagnosis, but the physical disabilities compound the cost and both personally and to the taxpayer program. So the role that you all play in advocating and helping Congress really understand this intersection and why it is truly urgent this year that we solve this problem As Dr. Fullen was saying, in 1989, we had a very different economy, fewer Medicare beneficiaries, and this coverage gap was not quite as serious as it has become over time. So we will, we're happy to be a resource for all of you, and I'm going to close. I don't want to hold things up with respect to the raffle and the break, but we are truly grateful for your participation in this, and we're looking forward to having you interact with your members of Congress and getting the feedback from you about the response. The goal is for this outreach is to get as many people co-sponsoring the legislation, both in the House and the Senate. That's how we build momentum, is getting lawmakers to add their names as co-sponsors to the bill. We currently have 33 co-sponsors in the House. We've got about 10 in the Senate. The more co-sponsors, the more likely we are to have advocates within Congress who will get us a hearing, get us a hearing in both chambers, and get our legislation to the floor of the House for a vote. So again, thank you so much for everything you do, and we're really happy to work with you and the American Counseling Association.
Hi folks, it's raffle time. I'm Dominique Marslek, Government Affairs Specialist for the American Counseling Association. And I want to thank Christine and Dr. Fullen for their wonderful presentations today. And I want to select our winners for our raffle. We have 5 folks who in attendance are going to be chosen for our raffle. So let's begin with Gabrielle Pointer. Gabrielle Pointer today will win a copy of Introduction to Crisis and Trauma Counseling. Christine Batt will win a copy of A Concise Guide to Opioid Addiction for Counselors. Congratulations. Wayne Cagle will win a copy of Counselor Self-Care. Congratulations. Letitia Brown James will win 2021 Counseling Awareness Month plush eye mask. So that's an eye mask. So great, congratulations. And Kathy Eaton is going to win a ACA auto open umbrella. So that'll be wonderful when we get our raining season here in the Northeast. Okay, folks, so can I get the next slide, Gila?
I first would like to thank Christine and Matt for that presentation. I also would like to once again congratulate the raffle winners. Our next session is really an awesome session. We have 2 gentlemen directly from the Hill that will talk to us today about their experiences. So I would like to really just thank them and introduce them. Crozier Connor is the Senior Legislative Assistant for Congressman Mike Thompson, who's a Democrat from California. He handles tax, economic, and healthcare policy. In this capacity, Crozier has overseen the process of crafting the Connect Act 2.0 and the additional telehealth legislation for the 116th Congress, and has worked to advance substantial green energy and disaster relief tax legislation. Crozier has worked for Representative Thompson since graduating from Colgate University in 2015. Also joining us today is Jay Eberly. Jay currently serves as Senator Barrasso's Health Legislative Assistant. Senator Barrasso is the chairman of the Senate Republican Conference and a member of the powerful Finance Committee. Jay joined Senator Barrasso's staff in 2011. He began his career on Capitol Hill, working for Senator Bunning from Kentucky. After Senator Bunning's retirement, he worked for Representative Chip Kravick from Minnesota, handling the congressman's work on the House Science, Space, and Technology Committee. He also holds an undergraduate degree in government from Centre College and a master's degree in legislative affairs from GW, George Washington University. Jay is married to his wife, Allison, a nurse practitioner at Johns Hopkins Hospital, and they are parents to 3 children. Crozier and Jay, thank you for joining us today. Next slide, please. Next slide. I'm sorry, ladies and gentlemen. We're going to get to the next slide a little later. What we are going to do is jump right into questions. Again, Crozier and Jay, thank you for joining us. Please feel free to share your real life experience when you answer these questions. Our members are extremely excited to hear from you. So I want to start with what I would say is a really simple question, but our members aren't necessarily aware. So could you all tell us what a typical day or week is like in your role? And we'll start with Crozier.
Sure. Thanks for having us. Not really sure I have a typical day. I would say each day brings some new challenges. I think I would sort of bifurcate my job into three sections. I think number one, I have a lot of meetings. Like you said, I do both economic and healthcare policy for my boss. So stakeholders from our district and from around the country will come talk to me about their priorities and legislation that they're interested in, much like you all are doing. Secondly, we're a very constituent focused office. We represent about 800,000 people in Northern California. And so I deal a lot with constituents directly, whether it's, I would say like recently helping people get hooked up with the SBA to get a PPP loan, or people who are trying to track down their Social Security benefits or whatever it is. And then lastly, I work very closely with committee staff. I mean, Congress is broken up into committees. My boss is on the Ways and Means Committee, and so that's where I spend most of my time. But working with the subject matter experts to craft legislation, thinking about what do we need to do to move my boss's priorities forward, gathering co-authors, working with the Congressional Budget Office, that sort of thing. And I would say that that's pretty typical. It's been, I would actually say, even busier in the COVID era. I think there's been a lot going on between healthcare and the economy. But yeah, that's what I do.
Okay, thank you, Crozier. We appreciate that. Jay, will you take the same question?
Sure. I think Crozier answered that pretty well. I think there's a lot of there's virtually, I would say, just echo his comments and all of that. And the one thing, that sometimes is a little different when you talk about House versus Senate is obviously we represent an entire state, but Wyoming's a little unique in the sense that we actually represent fewer people than Crozier's congressional district. So we obviously also are very heavily constituent focused with Senator Barrasso's office. And so that might be a little bit different than some of the other Senate offices you interact with just based on population. You obviously can't, the staff sizes, you might think California has a substantially bigger staff and it's slightly bigger, but it's not, it's not based directly on population, we'll put it that way. So just be aware of that as you kind of do your meetings up on the Hill, especially with Senate offices. They are responsible for the entire state, which means obviously sometimes they can get spread a little thin, but again, Senator Barrasso is very focused on constituent service because we represent, fewer people than one congressional district. So yeah, and there's not a typical day. One of the great things about this job is that it's not typical. And that's good. It's something that has always appealed to me personally. I think coming in and doing the same thing every day is not appealing to me, at least on a personal level. So being able to have a variety of activities is just something that's very neat and I think unique about working on the Hill.
Thank you for that answer. I appreciate it. And I definitely agree. There is no typical day on Capitol Hill. Can you both do this? And Jay, I'll start with you. Can you take a moment and share with our audience, what is your role in helping the member understand the issues and concerns that come to you?
Yeah, and I might be in a little bit unique position. So for those of you who don't know, I think probably mentioned on the previous session, Senator Barrasso is a physician. He's an orthopedic surgeon. He practiced in Wyoming for about 24 years before his appointment to the United States Senate. So I would be lying to you if I said that I need to walk into Senator Brasso's office and explain to him how Medicare works. He watched it work for over 2 decades practicing medicine. And so that's not really my role. My role in my particular position is really to try to be an extension of Senator Barrasso. In other words, my job is to try to, when constituents call us or stakeholders contact us, my job is to try to put myself in his shoes. And I've worked for him for over a decade at this point. So my job is to say, if Senator Barrasso were here right now in this meeting, what would he say? How would he react? What would he want to know? So I can take that information to him and try to communicate as clearly as possible what's going on, and frankly, most importantly, what are the concerns of folks back home in Wyoming? Because that's our number one focus. Those are our marching orders every single day, and Senator Barrasso makes this perfectly plain when we're in group meetings or when I was hired. Frankly, he's made it very clear. My priority is taking care of the people in Wyoming, and so that's really my job. It's not to, if that makes sense, it is not to kind of explain to him the ins and outs of some of these policy matters. He knows that from his experience, but rather to kind of be able to accentuate and kind of make sure, I'm reflecting how he views issues when we're interacting with people.
Thank you for that answer. I really appreciate it. Crozier, I'm going to move over to you for a second, and I'm going to go with a different question for you. I would want you to put yourself in the shoes of a constituent. And if you were walking into the office to meet with yourself, what would you do to have a successful meeting, and what wouldn't you do?
Sure. I think a couple things. I mean, number one, I think it's important that when you go to meet with a member of Congress or their staff, you should really try to have a clear-cut ask. Like, there should be a request that you're making of that member. And candidly, I would try to keep it to like 1 or 2 asks. Sometimes I get meetings with groups and they give me like 8 pages of PDFs. And I just like, I can't do 17 different things for everybody who walks in the door. And it's important. I mean, our schedules are pretty chaotic. And I think you want to leave them with a clear-cut request. Like, this is the group I met with. This is what they want my boss to do. I'm going to run that out and I'm going to get back to you. I think that's really important. And then the second thing I would say is it's always really helpful for me if you can tie the issue you're meeting with me about to our congressional district. And this isn't always possible. Like, there may be some areas of policy where Northern California isn't particularly impacted or whatever the case is. But I think, Mike's first question, whenever he gets asked to sign a letter or co-sponsor a bill or vote one way or another, like, the first question he asks is what does this mean for the people I represent? And so I think the have a clear-cut ask, know what you're asking the staff to do or asking the member to do, and to the extent that you can, try to find a connection to their district. I think that you will always be you'll always get a more responsive, more engaging meeting if you can tie it to the people that are represented.
Thank you for that answer. Jay, do you mind taking the same question?
No, not at all. And I would echo that. You make it local, make it personal to you. As Connor said, I mean, we take a lot of meetings. That's something that we do a lot of, and we want, and we see a lot of good meetings, and we see a lot of not so good meetings. And to make your meeting productive, you need to make it local, make it about you, but more importantly in the healthcare space, make it about your patient, right? I mean, at the end of the day, when you're talking about any healthcare policy issue, it is always more powerful to make it about how it's going to impact your patients in your practice, providing care in your community. Because that is the thing that members are going to remember. Because keep in mind, right, we do a lot of meetings as staff, but we're doing a chunk of the policy issues in the office, right? The members are doing meetings pretty much, back. It's not unusual to do back-to-back meetings all day, pretty much, or at least all afternoon. And so make sure that you make that personal connection. And secondly, even more importantly, do your homework on the member that you're meeting with. This is the age of the internet. You should know what town they're from in the district or in the state. You should know what they did for a living before they got to Congress, because you should be able to make those personal connections in the meeting, because that's what's going to make you stand out to the member. And it's what's going to make the member come back to the staffer and say, hey, they asked me to do this and I remember them because of these three things. These are after all human beings. And just like when you meet somebody for the first time, right? And you may have something in common, right? And it comes out maybe that you know a colleague, or you worked in, at a similar place, or you had a similar job, right? It's those little pieces that sometimes make the interaction noteworthy, and you want to do that for your member. And so the more you can make it local and make those personal connections, the better. And again, in the age of the internet, you should certainly kind of be able to get that background information before you have the meeting. So I encourage you to do it.
Great answer. Keeping it local, personal, and getting the background information on the member makes a big difference. Thank you for sharing that. Jay, I'm going to stay with you here for a little second. I want our members to understand that there are many issues you work on. So can you, as well as Crozier, can you just give us an idea of how many bills you focus on in any one session, and how constituents can really help their bill move to the top of the priority list for the member?
Yeah, I should have looked it up. I'm in my office in the Hill right now. I could take out the stacks of memoranda, basically, that I keep in the drawer that are copies of things that I've shown Senator Barrasso, and that's a pretty thick stack over 10 years of working here, and those are just the bills, keep in mind, that I have actually sent up for his approval, like to get him to co-sponsor or introduce, right? Those aren't the bills that I've just reviewed personally and for whatever reason have decided not to show him. I would say per Congress, we're talking hundreds just in the healthcare space of things we review. So it's a pretty substantial workload. To get it to the top of the list, again, we've talked about it. You need to make it relevant to your member and make it relevant to the state and the place where you live. Frankly, nothing is more irritating, at least to us, at least to me, when you get FaceTime with a senator or a member of Congress and you have an ask, you have something you want him to do, and the first question from the member is, how does this impact you? And I've had meetings where the person goes, well, it doesn't impact me at all. And I think, oh my, you've got your 15 minutes with a senator, you've asked him to do something, and in fact, you've just acknowledged that it really doesn't have an impact. Keeping in mind, right, that we've got a stack of memos where it does have a direct impact. And so, yeah, you got to make it local. That will get it to the top of your list. Also, we haven't talked about this, but make sure you build a relationship with your member and with your staffer. Don't get discouraged if you have a meeting and you don't see instant support, if that makes sense. Keep in mind that smart members that are seeing legislation for the first time, probably are not going to instantly agree with you for the simple reason that they want to do their homework. And that's a really good trait to have in a member of Congress. If a member of Congress has never heard of your issue and never heard of you and decides right there in that meeting to sign on to the bill, that may be a victory for you, but from a process perspective, that's not a great thing, right? You want your member of Congress to really put a lot of thought into the decisions they're making and really understand the issue. And so therefore, build that relationship with the staffer. Understand you're probably not going to get an instant response, and that's okay, but make sure you're building that relationship and following up with the staffer. Crozier and I, all congressional staff, we all do visits back home. I mean, that's a chunk of our job we haven't talked about, but we go and we visit. I visit healthcare entities in Wyoming all the time, right? And I choose places with people who have invited me. And it's based on a relationship that we've developed over the years. And when I go back, I visit and want to see kind of how these policies are directly impacting people on the ground. So yeah, to get your legislation to the top of the heap, make it local, build that relationship with both the member and the staffer. And part of that relationship is, making sure they come back and see what you're doing. Because again, that can really help elevate your issue.
Thank you for that answer. I really appreciate it. Now, I want to circle back to relationships in a second, but before we do, Crozier, I'd like to come over to you for a second. Will you take that same question on your side? What do constituents need to do to get their bills moved to the top? Do you have anything to add?
No, I think Jay nailed it. I think the bills that will be top priorities for Mike are the ones that affect our district. I mean, it's that simple. Like if and listen, like Jay's right. I mean, in a Congress, between the economy and healthcare, there's probably 1,000 bills that like will at some point get mentioned to me. The ones that stand out, the ones I make sure Mike sees, the ones that am honed in on are the ones that I know are important to the people we represent. And I think, and I would just say, like, that connection is important, but it's a little bit what you make of it. Like, even if you like, I'm trying to think of an example, but like you don't have to be like a business that's located in our district, but maybe you have some employees who work in our district, or maybe there are people in our district who take advantages of the services that you offer remotely. Like you can sort of make the connection however you want. Maybe you've got an employee that was born in our district, and like so it can be a little bit what you make of it. And I would be proactive in trying to say very clearly, here's why this matters to the people you represent. And if you do that, you're, in our office, like and I think Jay's the same way. You're going to get an answer, and we're going to do our homework, and we're going to talk to the boss, and it'll be a productive meeting. But I would just echo what Jay said.
Thank you very much. It's very important to have that relationship within the district and understand how to explain the effects. So let's talk about the relationship. So Crozier, tell me this: what can a constituent do to begin building a relationship with you, other staffers, as well as congressmen and senators in their home state?
Email me. I mean, like our standing orders are, if you've got time on your schedule, you take the meeting. And if it's a constituent, I mean, you take the meeting that day. I mean, or as soon as your schedule permits. So I wouldn't be, I don't know that there's a lot intimidating about it, but I wouldn't be intimidated. Send me an email, explain where you're coming from and what you want to talk about, and I'll get you on the calendar. I mean, that's the job. So I think that first outreach is important. And then every member of Congress has a scheduler, someone who oversees their calendar. And so if you want a meeting with the member, either ask me or contact the scheduler. And if it works for the member of Congress, then you'll get on their calendar. I mean, it should not be an intimidating process for you. We're here for you.
Thank you. Jay, we have about 6 minutes left in this session. I'd like you to take that question, but I also want to talk a little bit about the legislation. So I'm going to give you a two-part. One is about the constituents and building those relationships. The second, talking about legislation, HR 432 SA28, the Mental Health Access Improvement Act of 2021. What do you all need that will help increase support from this bill amongst your colleagues on the Hill? What do you need from the constituents?
Yeah, I think as you guys discussed earlier, I mean, we need to kind of run up the score on co-sponsors, and I should give credit where credit's due. Breaking news here, Senator Grassley agreed to co-sponsor at about 8:30 this morning. So I've got to get the paperwork in this afternoon. But for those of you who are from Iowa, make sure you say thank you to Senator Grassley when you have those discussions with him. And we need to run up the score. I mean, co-sponsorships matter. And they matter when we're showing support to get things to the floor. And in the Senate, they especially are important to make sure we have them, Republican and Democrat. I mean, bipartisanship is really important because, frankly, as you guys may have discussed procedures, the Senate, we try to operate on a 60 vote threshold, or fancy word for saying you generally need 60 votes to do most things in the Senate. And so therefore, it's in your best interest to make sure you're demonstrating support for the legislation so they can see a clear path to that 60, that kind of super majority. So run up the score and make sure you say thank you when your member does that. If they co-sponsor a bill, follow-up emails should not be intimidating. Just say thanks for your help. And look, if a member has an opportunity, good members of Congress are traveling home quite a bit. And so, as part of that relationship building, you can invite them to your facility, to your practice, to where you work. And we can help you with that. Any good staffer will help you coordinate, and we will link you up with the right people in the office to make that happen. And that's an excellent way for you to help build relationships, not just with us, the people in Washington, but with folks, with staff kind of back in the state, back in the district. And members like doing that, especially when they've co-sponsored a bill or they support a bill. That's a great way to show your thanks, to show your support, and to kind of make that decision for them more real, to kind of help them kind of understand what they've done a little better. And again, that's just a concrete way you can kind of push the ball forward.
Thank you so much. Crozier, do you mind taking the same question?
You bet. I mean, I think Jay and I are kind of on the same page here. I think having, you are almost certainly not going to move a bill like this, which is real policy that costs $1 billion+ over 10 years. Like, you need to show leadership and the relevant committee chairs that this is important to members. And the way you do that is by getting co-sponsors. And so, I mean, I think you guys have been great on this in the past. Like, we've had really strong support for this bill in previous Congresses, but you can't let your foot off the pedal. Like, this bill will become law if enough members decide that this is a priority. And the way that you do that is by getting them to sign on to the bill. So I think, if the network that you have at your disposal, if you look at the map of members of Congress and you methodically go through them and say, we've got a counselor here and a counselor here and a counselor here, and we're going to get these members on, like that work will absolutely pay off, and it's necessary to getting the bill over the finish line.
Thank you for that answer. And I want to let both of you gentlemen know that the American Counseling Association, we are working with our members extremely close to make sure that we have at least one constituent in every meeting that we have. And this just isn't about our Hill Day meetings. This is just about what we do at the association. So I can guarantee you we're going to continue supporting this bill at a high level. And we really appreciate the work that you're doing to support this bill. But I'd like to close out with just one question here. And it's a simple one. Are there any additional tips that either one of you have for our members on how to be effective on the field and really just to feel more confident and comfortable when speaking to you or your bosses? Jay, we can start with you and then we'll close out with Crozier.
Yeah, I think as Crozier said, I mean, one, don't be intimidated. We're here to serve you. That's our purpose. That's our sole function. At the end of the day, when you boil back what a congressional staffer's job is, our job is to serve our constituents. It's, we're here to help our members, but ultimately we work for the people of Wyoming. Crozier works for the folks in California. I mean, that's our job. So you should never be intimidated when talking to us. The other practical tip, and the American Counseling Association is very good about this, but just something to think about. When you're talking to a congressional staffer, sometimes meetings, Wyoming's a good example. Sometimes we have a Wyoming constituent, and then sometimes groups will put in a couple of people from surrounding states or regions just to make sure they have kind of more people. And importantly, make sure in your meetings that the constituent is always the one speaking if they're available. Nothing will irritate a member of Congress more than having a meeting with a constituent, and then all of a sudden he's hearing from 3 or 4 people who aren't, in our case, Wyoming residents, when there's a Wyoming resident right in front of him. So don't be intimidated. I know that sometimes if it's your first time talking to a congressional office, sometimes folks are more comfortable letting somebody else take the lead, someone else talk. There's no reason for that. And frankly, from my perspective, you actually probably do yourself more harm than good. You think maybe you're letting someone who has more experience kind of take the lead, but the most important thing is that member hearing from the person who lives in their district and in their state. So don't make that mistake. Speak up, advocate on your own behalf, and you'll be just fine.
Thank you so much. Crozier, you get the final word.
No, Jay nailed it. I mean, go in with a clear-cut ask. You want members to co-sponsor this bill. and make it local and say, this is why this matters to the people that you represent. And I think you'll have a satisfactory outcome.
Thank you so much. And one last thing before we close out, I want our members to know that on this call today, we have Jay and Crozier. One's from the Republican Party, one's representing the Democratic Party. And as you can tell, the answers that they provided are aligned. It's very important that we stay aligned with them in order to push our agenda forward. They are extremely helpful to the work that we're doing. They are our champions. And we sincerely thank you, gentlemen, for being with us today. The information you shared is definitely valuable to our members and everyone that is on this call. So thank you so much for joining us. Before we move to our next session, we actually have a quote from Representative Thompson, who wanted to join us today, but he is tied up, as you can imagine. And I'm actually going to read this because he sent this in personally. He says, "I am proud to work closely with the American Counseling Association on my bill, the Mental Health Access Improvement Act. This bipartisan legislation will help seniors who are at greater risk for mental illness and can often find it hard to get access to mental health services they need. Thank you for your advocacy on this important legislation, both today, during your virtual fly-in, and throughout the year." So a sincere thanks to Representative Thompson, to Crozier, and to Jay. Thank you, everyone. Next up, we're going to move over to Ms. Dania Lofton. Thank you, everyone.
Thanks for having us.
You're welcome. Thank you.
Good afternoon, everyone. We get to now talk about the really fun part of advocacy and the most impactful part of advocacy. But before we get started, wherever you are, just repeat after me. Mental health is health. Medicare advocacy is client advocacy. And it's time to modernize Medicare. And remember, keep it local. So let's talk about meeting with your legislators. We're going to talk about how to handle scheduling these meetings, how to conduct a productive meeting, and then how to follow up with your members and some lobbying tips. So let's talk about scheduling the meeting. We heard a few moments ago that you can email the staffer directly or email the scheduler. But first, you want to start by visiting the legislator's website, or you can come over to our ACA Take Action page, and you can scroll to the bottom of that page, put in your address, your zip code, and we will tell you everyone that is your representative from the state level all the way up to the federal level. From there, you can get their phone numbers, websites, and you can call those offices to schedule those meetings. If your constituent living and or working in that district or state, make sure that you mention that when you call to schedule your meeting or when you send that email to schedule your meeting. You want to also ask to speak with the legislative aide if you're calling. And if you are emailing that legislative aide, you can go on their website and find out who handles your issue. So let's talk about the meeting format. When you go, you've gotten this meeting, you're going to meet with them on a Wednesday at 10 o'clock a.m. So you're going to log in, because right now we're meeting virtually. You're going to log into your Zoom, and well, let's just assume it's Zoom, right? And when you get on there, you want to introduce everyone that's on the meeting with you. You don't want to bring too many people to the meeting with you. I'd say keep it at 4 people, because you want everyone to get a moment to say something, and you only have a few minutes with these members and their legislative staffers. So once you start that meeting, introduce everyone that's at the meeting, provide some background on why you're here. You want to tell them, for example, that you're here to discuss how the COVID-19 pandemic has affected mental health nationwide and the value of counselors and the counseling services. Then you want to offer a brief discussion of the context in relation to your issue. For example, you may want to say why Medicare coverage for mental health services is more critical than ever. Then from there, you want to talk about you want to clearly state what you're asking them for and next steps. So we'd like for you to sponsor the Mental Health Access Improvement Act, HR 432, if you're meeting with a member in the House, or Senate Bill 828 if you're meeting with a member in the Senate. Here's the most important part. You want to tell your story. You want to tell how this impacts that legislator's district. So how do you do that? You want to effectively persuade these legislators to take action by offering them a compelling, relevant, and relatable story. For example, you might say, I'm a licensed counselor here in Virginia. At least 60% of my clients have transitioned to Medicare over the last year, and I've been unable to continue their care because Congress hasn't updated the Medicare provider list since 1989. Once you've done that, you want to give them that call to action. This is that ask that we heard about a moment ago. And remember, you only want to stick with 1 or 2 asks. So you're going to conclude your meeting with the call to action, and you're going to ask them very specifically. On our next slide, you'll see something like, we'd love for you to sponsor the Mental Health Access Improvement Act, HR 432, again, if you're meeting with someone in the House, or Senate Bill 828, if you're meeting with someone in the Senate. You want to always thank them for their time and support. Here are a few additional tips. When you are meeting virtually, keep your camera on even if theirs is off. You want to engage equally with the legislators and staff members. Remember, the staffers have influence, and you're most likely to meet with a staffer. Assign roles and topics ahead of time. So you want to determine who's going to do what, who's going to do the introduction, who's going to give out the statistics, who's going to share their story, and who's going to make the call to action. After your meeting is over, you want to always follow up with a personalized thank you email and appropriate social media messages. And remember, do your homework. So when you're sending those messages, you know exactly who you're talking to and you're able to personalize it even more. And then you want to also tell them thank you for championing the Mental Health Access Improvement Act and helping at Counseling Views increase access to mental health services for more Americans. #CounselorsHelp. Now, I know we've gone through this very quickly, but just a few more pointers. You want to keep the conversation going. So if you're virtual or in person, you want to attend town hall meetings, and they do host those virtually or in person. These members do have district or state office hours during congressional recess. Sign up to meet with them there. Social media campaigns, participate in those campaigns. Thought leadership pieces for local and national media outlets. Dr. Fullen is really great at doing that. Virtual ACA region or branch forum featuring a legislator. Host a meeting and invite a legislator to come and speak. Or local coalition building. Get members of your branch or your region together and do letter campaigns, have meetings, and more engaging activities with your members of Congress. Next up, I want to introduce 2 ACA members who have actually engaged in meetings with their members of Congress. First up, we'll hear from Dwayne France, followed by Ajita Robinson.
Hello, good afternoon. My name is Dwayne France. As Dania mentioned, I have previously participated in legislative meetings on the Hill. This was, of course, before COVID. So I am currently the co-chair of the Public Policy and Legislative Committee. Have been doing that for the past 2 years. And I've had the opportunity to share some time on the Hill, both part of the ACA's leadership development program, but also had the opportunity during not last year, but the year before the fall, to actually set some meetings on the Hill to be able to have some conversations about a number of different legislative efforts, but specifically to improve Medicare. Some of the advice that I have is very similar to what others have provided, but we are the subject matter experts. We know what's best. We know what it is, we're subject matter experts with our own personal experience, especially when it comes to counseling. I cannot stress enough to be able to make sure that you have stories. One congressional representative that I know of once said to a group of us, there are 2 types of people. There are people who write checks and people who tell stories, and the people who write checks don't do so unless the people who tell stories tell compelling stories. So for example, from my own perspective, coming from a military background, working with service members and veterans, I was able to communicate the fact that the Medicare changes also impact service members significantly. So Medicare, as we know, is for older adults, but is also for seriously and severely disabled individuals. So a severely wounded, ill, or injured service member who's discharged, who then who gets on Social Security, will then have Medicare after a period of time. And so you have, if I have a client who is a veteran who is using their TRICARE, for example, who now they are on Medicare, Medicare becomes the primary payer. I, as a licensed professional counselor, even though I'm a combat veteran and a clinical mental health counselor since 2014, can no longer serve them. Almost overnight, it switches a flip. So being able to have those conversations or on your own experience, to be able to describe to the congressional staffers why this is so meaningful. But also the idea of making sure that you have connection to the staff. Dania mentioned it several times. You will most likely interact with the staff. I wouldn't say only expect to interact with the staff. I recall when I was meeting with Senator Gardner's office, Senator Cory Gardner, that I was anticipating meeting with his veteran liaison, military and veteran liaison, but then Senator Gardner walked in the room and we had about a 30 to 40-minute conversation, just he and I and a member of the government affairs team. So very significant. Don't be surprised if the member of Congress themselves joins you. And also, as has been mentioned, they're very busy, and their staff is very, very receptive and very, very much able to communicate. So I'm not sure if Brian or Dania, if you had other questions or anything that you feel might be helpful for the attendees to know.
I think you did an excellent job, and so good that I'm going to toss it over to Ajetta Robinson and let her tell us about her experience.
Thank you so much for inviting me to the conversation. I am the recent past president of the Maryland Counseling Association and just a lifelong advocate at the local and state level as well. And so I have been involved not only in Advocacy Day, but in building relationships with my local and state representatives for the past 10 years or so. I own a mental health practice here in Maryland where we're often serving those who are in the gaps, who have traditionally been uninsured or underinsured. And so that's often the perspective that and the voice that I am bringing to the room. And so some things that I would say are important to note is to know your audience. So know who you're speaking to, who's in the room. If you can, understand what their position has been in the past so that you can make it personal. And again, not in a way that attacks anyone's viewpoints, but that allows you to build relationships. And I think this is something that as counselors in particular, we do very well, right? Is being able to take a person's perspective and find ways that we can identify, but also help them understand the impact or the implications of certain bills or pieces of legislation. I wouldn't make the assumption that your representative or their staffer has read the entire bill. Again, that's not meant in a demeaning way, but they're hundreds and hundreds of pages oftentimes. But that is, it's important that we engage in some education. Again, that's about partnering, that we are subject matter experts. I really love that Dwayne and previous speakers have brought that up. And we have the real world experience about that highlights what the actual impact, not the intent of certain legislation, but the impact will have not only on us as a profession, but on those that we serve. And so I think those are pieces that are important. It's really easy to make decisions if we're looking at data, if we're looking at aggregate data. But when we talk about the actual implication of this legislation on our service members, on our seniors, right? We all have had some experience with a senior, a grandparent, or someone that we care about that often will help us with having a different perspective, right? Because there are people who are affected by the decisions that we make or our inaction. I also think that it's important that we build relationships. This is ongoing effort, and that it's not limited to a day. Being that we are subject matter experts, we want to be able to position ourselves that when our congressperson has a question about the impact of something, that they remember we're top of mind. I can't tell you how many times I've been contacted, even by our local superintendent of schools, to say, hey, this is something that we're noticing or thinking about, and we wanted to have your expertise or your thoughts about what this actually means. I've had the same thing happen with Lieutenant Rutherford's office here, where his assistant has contacted and say, hey, the Lieutenant Governor wants to speak with you about something that was in the news with respect to Medicaid in our state. And so you are a resource as well. And so we want to create relationships so that it's not just this given, this us asking for something, although that is what they sign up to do, but allow yourself and position yourself to be a resource so that we can be a part of informing legislation, as opposed to simply on the back end, right? If we can be preventative, if we can be involved and engaged in crafting and promoting some of the language in legislation, then we can have impact and intent more closely aligned with one another. And so those are some pieces that I think are important to just consider when navigating and having these conversations. And I think the relationships and having informed conversations are really, really important to keep in mind.
Thank you, Ajetta, and thank you, Dwayne, for your insights on this. And I'm going to be completely honest with everyone on this call. When you meet with your legislators and you meet with their staffers, if it's the first time, it is a little bit scary for maybe 60 seconds. But once you realize that these are just regular people, just like me and you, and they want to hear about your issue and they care about your issue because they care about those constituents, it's easy peasy. So I want to thank you all for joining us today. And if you have any questions, please feel free to contact us at advocacy@counseling.org. That's ADVOCACY@COUNSELING.org. And for any additional resources with the information that we've shared with you today, please feel free to visit the Kaiser Family Foundation, Rural Health Research and Policy Centers, Bipartisan Policy Center, and Sitterstone.org. But before you leave, before you log off, we have one more raffle, which is why Dominique is now here to give you that last raffle.
Hi, folks. Surprise, we have one final raffle for those who were persistent enough to stay throughout our entire event today. We are so thankful for your attendance. So thank you to our phenomenal speakers and panelists. Thank you for staying throughout the entire session. And to show our thanks, ACA is going to raffle off for, awards for 5 more folks. So we are going to pick 5 folks. So let's start with Kadar Ishmael. Kadar, you have won a soy-scented candle tumbler, a Burn Bright soy-scented candle tumbler from ACA. Congratulations. Eric Davis, you've won an ACA branded camper mug. Congratulations. Alva Perry, so you've won a power pack, battery packed, ACA branded battery pack. Congratulations. Okay, Monica Starovic, thank you for staying. You've won a face mask with pocket for a filter insert. Congratulations. And Yolanda Bronner, finally, you've won a notebook with 12-piece color pencil set branded with the Be Kind logo. So thank you so much for staying the entire time, for taking part in our virtual Hill Day. We're so thankful. And we're here if you have any further questions. You can reach us at advocacy@counseling.org. Thank you.